blindness and the social barriers to its elimination. Before we go into details, here are some of the commonly used definitions. A child is defined as the age less than 0 to 15 years. Blindness is defined as a presenting visual acuity of less than 3 by 60 in the better eye or central field less than 10 degrees, and severe visual impairment is defined as less than 6 by 60 in the better eye. Globally, 1.4 billion children are blind, and out of this 1 billion children live in Asia and Africa. So, in poorer countries, the percentage children in the population is very high, and so is the prevalence of blindness. The prevalence of childhood blindness correlates very strongly with the under 5 mortality rates. The incidence of blindness in children, it is estimated around 5 lakh cases per year, that is around 1 per minute, and 50% of these cases, they die within 1 to 2 years of becoming blind. The also prevalence study actually underestimates the magnitude of the problem of childhood blindness, as this only takes account of the children who survive. Why it is important? Because the number of blind years they contribute is second only to cataract, which is the leading cause of blindness worldwide. And where do these blind children live? After sub-Saharan Africa, India is the home of majority of blind children in the world. In India, children less than 16 years, they form 40% of the population. That is roughly equal to 400 million children, and 3,20,000 children are blind. The prevalence is roughly equal to 0.08%. 60% of blindness, they occur in less than 7 years, and 60% of these children die within 1 year. Very few prevalence studies are there, and there are only a few population-based study because of the large sample size required, as discussed by Dr. Sandeep, and mainly hospital-based data and blind school data are available. These are some of the landmark studies which have been done till now, and coming from these studies, corneal blindness is one of the leading cause, followed by cataract, which is more in hospital-based studies because more children come to hospitals for surgeries, and this is followed by retinal dystrophies, anophthalmos and microphthalmos. Comparing this with the developed countries, retina is the most common affected site as compared to cornea and lens in the developing country. This is the global picture for pediatric blindness, and it shows that 28% is preventable. In India, it is up to 50% which can be prevented. And here is a list of preventable causes, out of which are corneal scarring, intrauterine factors like rubella, infection, toxoplasmosis, perinatal factors like ROP, birth hypoxia, hereditary factors. Treatable factors are cataract, glaucoma, and ROP. Corneal scarring is one of the leading causes of pediatric blindness, and the prevalence ranges from 11% up to 36%, and interstate variation has been noted. There are more cases in the north and the northeastern state as compared to the south. And vitamin A deficiency disorder is one of the leading cause. Xerophthalmia was noted to be around 9.1% in Aligarh district of UP, where it was considered to be a major health risk factor. According to the IPB, if the infant mortality rate is more than 50 per 1,000 live birth, then these are countries where poverty is widespread and access to service is poor. We have to assume that all children under the age of 5 years have got vitamin A deficiency. The current IMR is 57.3% according to the International Journal of Lancet 2013. And the poorer states of India, UP, Bihar, Rajasthan and MP are the most commonly affected states. Our own data from Bihar show that 4% of the patients who come to the pediatric OPD have got vitamin A deficiency disorder, which will later be discussed by Dr. Shilpa. Congenital cataract again is very important, and with a prevalence rate of 0.2 to 1.5 per 1,000 population, and it is more in the developing world, and it contributes to 14% of all the childhood blind years. In India, 50,000 cases are born each year, and 25% of these are due to congenital rubella syndrome. Congenital rubella syndrome continues to be a major preventable disease because rubella vaccination is not a part of the national immunization program. ROP again is very important, especially in the middle income country, because of the improvement in neonatal care has given rise to what is called as the third epidemic of ROP. Since the economy of India is emerging, so ROP can be the major emerging cause in India. This photograph has been taken from an NICU from Vaishali district of Bihar, and it shows a baby being given unmonitored oxygen to save his life. Another important cause is anophthalmos and microphthalmos and glaucoma, accounting for 20% of the cases. A cluster of 35 cases were noted from Bihar in 2009 and 10, mainly from Bhojpur, Buxar and Rohtas. Mother of these children were shown to have reduced iron, increased iron and reduced magnesium and zinc. No causal relationship has been established. However, the arsenic map of Bihar shows an increasing level of arsenic in various districts of Bihar. And arsenic can itself induce cytogenetic and gene mutation. Anophthalmos and microphthalmos is one of the congenital malformation associated with arsenic. So maybe can it be the cause? We need to research in this field, and genetic research should be done. Refractive error in children is another important cause, and it is responsible for 95% of visual impairment in children. 12.8 million children are visually impaired from refractive error. The global prevalence is 0.96%. It interferes with the children's education, affecting the future opportunities in life. What are the barriers? The social barrier is very important, and it is mainly due to uneducated women, poverty and cultural practice. Delayed presentation due to social belief is very important in congenital cataract surgery, and it can be a major factor for poor outcome of surgery. The social belief like the child is too young for surgery, the eye will get better as the child grows, are the two important questions which were found in these patients. The picture is of a 12-year-old girl who has congenital cataract. Her younger brother also has got cataract. Other important factors are lack of screening at birth and preschool, surgery difficulty, lack of pediatric team, lack of pediatric anesthesia, poor follow-up. And there are also barriers to subspecialty training because of the lack of human resources. The burden of eye disease, especially cataract, is so high. The prohibitive cost of instruments and supplies, lack of clinical program, lack of training program, and few discussion forum. This is the projection of bilateral blind children with and without intervention, and you can see very easily the difference with and without. So first of all, we need to see where we stand, and then we need to intervene before it is late. Thank you. Thank you.